How is everyone holding up? Okay. So I'm very pleased to be here to talk about incarceration and HIV transmission risk among former inmates and members of their sexual network. And I think Sean and I will have a lot to talk about after this session, because his point about trying to understand influences of incarceration is difficult because of lack of a control group. So a caveat to my work in this talk is, I do look at compare incarcerated populations versus those who don't have histories of incarceration, and those with criminal justice involvement versus those who don't. And it's really apples and oranges. So in epidemiology, we try to control for as many things as possible to really tease out influences of that one variable of interest, in this case incarceration and criminal justice involvement. But certainly there are limitations to what we really can do in terms of inference, at least at this point. But as far as the HIV epidemic in the U.S., we have remained at similar levels since the 1990s in terms of incidence. So we still have about 50,000 new infections annually. And as you see from the graph, African Americans have accounted for and continue to account for a disproportionate number of those new infections. So they account for 50% of new infections, yet compose only 13% of the population. And so when trying to understand the race disparity in HIV infection and HIV transmission in general, it's important to consider incarceration because of the disproportionate race disparity in incarceration. Okay, so there are high levels of HIV infection observed among inmates and their sex partners. So there are multiple correctional facility studies prevalent studies that show prison inmates have about 3 to 5 times the HIV prevalence as those in the general population. And very high incidence has been observed among recidivists in particular, as compared with those who are continually incarcerated. And in addition, there are studies that show that people who have sex partners of prisoners, have elevated rates. So certainly there are many factors that drive infection in HIV infection among those involved in the criminal justice system and members of their sexual networks. So poverty, substance use, mental illness, trauma that underlies these factors, these are all syndemics that influence a person's risk of getting incarcerated and are involved in the criminal justice system in general, whether it's arrest, probation, incarceration. And they also drive infection risk. But the question that myself and others in my field have been interested in is criminal justice involvement itself a risk factor, working concurrently with these other factors? And if it is, why is it? Let's think about the causal pathways that potentially could lead in criminal justice involvement, arrest and incarceration, to influence a person's HIV risk. And is it something about the disruptive effect of incarceration on families and communities that plays a role? And I should say that prior to doing work on incarceration, I did international work on mobility and migration, which is a well-established risk factor for HIV and the risk behaviors that drive HIV. And incarceration for many, because of the high rate of recidivism, it's like a form of mobility and migration here in the U.S. So some of the same mechanisms that drive HIV infection in mobile populations and migrant populations are likely to play a role here in the U.S. in terms of incarcerated populations. Okay, so I'm going to go through a conceptual model, describe some evidence that is empirical support for incarceration serving as a risk factor for HIV infection, and then talk very briefly about how incarceration can disrupt, some empirical evidence for incarceration disrupting partnerships and how that may lead to HIV. So just some brief infectious disease transmission review. But basically, for an infection to grow, for R naught to grow, we need 3 parameters. There are 3 parameters that affect this: beta, C, and D. So beta is the risk of transmission per sex contact, which is influenced by how infected an infected person is, how susceptible an uninfected person is, and interventions such as condom use, antiretroviral therapy. C is the mean rate of acquisition of new partners per unit time. So this is influenced by 2 parameters. One, the rate of new partnership exchange as measured by variables such as multiple partnerships, concurrent partnerships, sex trade, and the rate of discordant partnerships. So people can be having multiple partnerships, seeking out new partnerships, but if there's no meeting of an uninfected with an infected person, it's not going to do anything for an epidemic. So you have to have discordancy happening. And then the duration of infection is also a parameter that influences the rate of epidemic growth. So in my work, I really focus on the C, the acquisition of new and susceptible partners per unit time. So I'm going to talk a lot about outcomes such as multiple partnerships, concurrent partnerships, and discordancy. So in terms of criminal justice involvement in HIV risk, there is a model, the proximate determinants model of HIV transmission, which I've used and adapted along with Megan Comfort, who is here, is going to be speaking later today, and a colleague of ours, Matt Epperson, to try to understand how criminal justice involvement can influence HIV. So it's hypothesized that criminal justice involvement works through these three proximate determinants to lead to HIV infection. And for the sake of time, I'm going to focus on how the model works for influencing the rate of contact between susceptible and infected individuals, so multiple partnerships and concurrency. So criminal justice involvement, by definition, is a disruptive event. It pulls an offender out of the community, which has consequences for the family and communities that are left behind. So the disruption of networks could lead to increases in new and multiple partnerships. For example, for companionship needs, if a partner left behind has to find a new partner because they no longer have a partner, or for financial reasons, if the person who has been incarcerated has been a source of financial support. And so the partner left behind in the community has to find someone to financially support her or him. The disruption of networks can also lead to reductions in social support, which has negative influences for the mental health of the inmate and or the person who's involved in the criminal justice system and their partners. This can lead to elevations in drug and alcohol use. So psychopathologies and drug and alcohol use are well-established risk factors for risk behaviors that lead to HIV and to HIV infection. In addition, criminal justice involvement, either working through the pathway of disrupting networks or independently, introduces individuals into high-risk networks. It's well established that when you go to prison, you're more likely to get involved or be exposed to networks that are characterized by gang activity, by drug use, or in drug trade. And those types of networks are more likely, it's been shown empirically, they have higher levels of risk-taking, but also they're more likely to be infected. So when you go to prison and you become involved in new networks that are higher risk networks, you're more likely to come into contact with HIV infection. And finally, criminal justice involvement can diminish employment prospects and financial solvency, which has negative influences on current partnerships. That weakens current partnerships, and it diminishes the probability of new partnerships, new stable partnerships from forming. When I talk about it diminishes the formation of new partnerships, I'm talking about stable partnerships that protect against high-risk partnerships. Okay, so this is one pathway. There are many ways that criminal justice involvement could influence HIV risk, and I just talked about one pathway as a caveat. But to put some legs on this is a schema that I'm going to go through. Here we have in the figure a male who is incarcerated and a female partner left behind in the community. So, of course, women are incarcerated, so it could easily be a woman who's incarcerated, and this schema could work the same for heterosexual or same-sex partnerships. But I'm going to focus on this heterosexual relationship for right now. So incarceration could lead to multiple partnerships, multiple partnerships for the partner who's left behind in the community, and upon release, absence of a partner with freedom from restriction on sexual behaviors could lead the released inmate to seek new partners if there's no partner waiting for him. In addition, it could lead to a special type of multiple partnership that's known to lead to elevations in HIV infection called concurrency, which are partnerships that overlap in time. If the if the prisoner finds new partners and then returns to the original partner shortly thereafter. In addition, incarceration has been documented in qualitative work and now quantitative work to be associated with sex trade, both among the partner left behind in the community and then upon release. Some of the people I worked with in North Carolina who had a long history of incarceration who were then field workers would say the first thing when they got out would be to go to English Road and find someone because they didn't have anyone and they hadn't had sex in 2 years. Okay, and then as I mentioned, incarceration could lead to elevations in contact between infected and uninfected individuals because of introduction into this higher risk network. Okay, so I'd like to go through evidence that incarceration is associated independently with HIV risk behaviors and infection. And this is controlling for as many things that we think drive HIV infection, including sociodemographic factors, substance use, of course, and background factors. Some of the data sets allowed us to control, for example, for delinquency or personality factors that may be driving factors for HIV risk. Okay, so the take-home of this slide is to say that in a number of different study populations, from North Carolina to Brooklyn to the general U.S. population, we see on average about, excuse me, something happened. We see about twice the prevalence of HIV infection among those who have been incarcerated or involved in the criminal justice system compared with those who have not, controlling for as many of those background factors that I talked about. And when I talk about the different outcomes, we have measured multiple partnerships, concurrent partnerships, sex trade, infection with STIs, and HIV. And the studies in these different samples tell the same story, that incarceration is associated about twice the increase in risk. I'm going to talk about some nuances. So we looked at, does the duration of the incarceration matter? So in epidemiology, we expect there to be dose-response relationships. The longer you're in, the more likely we would expect to see increases in HIV risk. So we looked, this was from a North Carolina data source, a population representative sample of African American. In this particular case, we looked at men. And we found that those who had a short-term incarceration, those who were incarcerated for less than 1 month, had about 1.7 times the prevalence of multiple concurrent partnerships in sex trade as those who hadn't. And yet when we looked at long-term incarceration, longer term than 1 month, there really wasn't an association that held. We also looked at this relationship using data from Bushwick, Brooklyn, where we had biologically confirmed infection with a number of STIs, chlamydia, gonorrhea, syphilis, and herpes, and HIV infection. And we found that regardless of how long the person was incarcerated, short-term less than 1 year, or long-term 1 year or more, that there was about 30 to 40% increased prevalence of these infections among those who had a history of incarceration. So, and then we're looking at this right now actually in Baltimore. It looks like short-term incarcerations are associated with elevations in risk behavior and infection, whereas longer-term incarcerations are not. And this is just to say that it is something about potentially the cycling in and out of the criminal justice system that may make a difference in terms of HIV infection. Okay. So we also looked at to what degree is early and repeated exposure to incarceration associated with high-risk partnerships and sexually transmitted infection as the outcome in this slide, actually. So we used the National Longitudinal Study of Adolescent Health because to take advantage of the longitudinal aspect of this study, and we looked at whether or not people were arrested for the first time. First, I'm going to talk about timing of first arrest. So those who were arrested for the first time as a minor, or as an adolescent, had 1.5 times the odds of STI, so chlamydia, gonorrhea, or trichomoniasis, as those who had never been arrested. Whereas those who were arrested for the first time as an adult didn't appear to have elevations in these infections. And I should say, when looking at the risk behaviors, we find a somewhat different story. Whether or not you're arrested for the first time as an adult or as a minor, you tend to have much higher levels of risk-taking, but for some reason it's not translating into affection, at least with this data source. In terms of persistent offending, we looked at, whether or not someone, stayed an offender, or whether or not someone, just was newly an offender. But those who were offender both in adolescence and adulthood had greater elevations in STI risk, and that those who, as an adolescent, had been arrested multiple times had over 8 times the prevalence, 8 times the odds of STI as those who had never been arrested. So clearly, repeat offenders and those who get involved early are priority populations for HIV and STI prevention. Okay, so does drug use account for associations between incarceration and HIV-related risk behaviors? So this is a common question I get from reviewers of papers and grants and talks. And, we try to adjust for drug use the best that we can in all of our models. But another question is turning it around. Drug use is such a strong, consistent risk factor for HIV and STDs. But there really isn't anything in the literature that speaks to whether drug use, which clearly is a risk factor for criminal justice involvement, also may work through the pathway of criminal justice involvement to influence risk. So we did a model using the National Longitudinal Study of Adolescent Health to look at marijuana use in adolescents and try to understand the degree to which marijuana use in adolescence predicts subsequent HIV-related risk behavior. In this particular case, in this slide, it's multiple partnerships in the past year in adulthood. And marijuana use, these are beta coefficients, but marijuana use is associated with about twice the odds of multiple partnerships in adulthood. People who use marijuana in adolescence are on a trajectory that leads them to elevations in risk behaviors in adulthood in adjusted analyses. We also found that a large proportion of that variance was due to involvement in the criminal justice system. Marijuana predicts arrest as an adult, which then predicts STI. So it's important to are trying to understand how to work with adolescents in terms of reducing their STI and HIV risk, that their drug involvement may also lead to criminal justice involvement, and that's a part of the story for why you see elevations in risk among drug users. Okay, so for partners incarceration, we did the same thing, and over a number of different study populations, we found in adjusted analyses, having a partner who's been incarcerated was associated with about twice the prevalence of risk behaviors and infection. Some of the estimates were higher, some were slightly lower. I'm going to focus on one particular study because it's some of the most rigorous data in terms of understanding partners' risk. So really in epidemiology, we do a lot of surveys and we ask people, tell me about you and all of your sexual behaviors, and then we test them for infection. And tell me about your partners. Has your partner been incarcerated? Has your partner used drugs? Which people actually don't know their partners very well. It's really striking when you look at network data and you can compare an individual's own response and then what their partner said about them. So in this particular data source, this is a network diagram from a study conducted in Bushwick, Brooklyn. And the people are connected through sex and drug links. So this basically, you have to be a sex partner or a drug-using partner to be connected with someone in the diagram. And the blue dots are incarceration. The red dots are infection with herpes or HIV. And what's nice about these data is that we know that a person's partner actually was incarcerated and actually was infected, as compared with using some of the sociometric, the egocentric data that I just spoke about. But what's clear is incarceration is very common in this network. This is a high-risk network, obviously. So it's people who were recruited because they were injection drug users, or there was one part that was a population-based sample. But incarceration is common. So if you're not incarcerated, you're connected with someone who is, and infection is common. So in this case, we see qualitatively or sort of pictorially that incarceration is associated with infection. This person who has been a history of incarceration has herpes or HIV infection. And we also see that this person, the black dot here, is linked to someone who has a history of incarceration and who's infected. And this black dot has no history of incarceration and is not infected. So this is a potential for transmission. This is a discordant partnership. And then we also see people who have been incarcerated but who are not infected are linked to partners who they haven't been incarcerated but they're infected. So getting incarcerated puts you in contact with a high-risk network, even if the person that you're linked with sexually or in terms of drug use has not been incarcerated yet. So we use these data to look at whether among those who are uninfected for STIs or HIV, whether or not they had elevated risk of having sex in the past 3 months with someone who was infected if they had a sex partner who was incarcerated. So people who had, among uninfected individuals, those who had one partner in the past 3 months had 1.4 times the prevalence of contact with a sex partner who had been infected compared with those who hadn't. And then those who had 2 or more partners in the past 3 months who had a history of incarceration had even higher risk of contact with someone who was infected. So clearly, having a partner who's been incarcerated is a marker for coming into contact with people who can potentially transmit infection to you if you're uninfected. So, summary of incarceration and HIV risk. Former incarceration is an HIV risk factor. It is associated across in a number of studies with elevations in risk-taking and infection. And it's associated independent of important confounding factors, including drug use. And in addition, those whose criminal justice history began early with repeat involvement or who appear to experience elevated risk. Short-term versus long-term incarcerations appear important, and this finding is corroborated by a somewhat recent meta-analysis that showed short-term HIV incidence was very high in short-term incarceration individuals, recidivists, yet among the lowest levels of HIV incidence were observed in those who had sort of continuously been incarcerated. So in terms of public health messages, trying to find those who are cycling in and out of the criminal justice system appears to be a first priority for HIV programming. And partners incarceration is an important risk factor. So I wanted to just briefly talk about, and I took out some slides because I thought I would be, how much time do I have? 5 minutes, okay. So basically we did a bunch of pilot studies trying to understand how commonly incarceration disrupts primary partnerships that are potentially protective against engaging in multiple partnerships and concurrent partnerships. And it was very common in both a community sample and in a prison-based sample. Incarceration was disruptive of what we would say primary partnerships. Many people say, well, marriage rates are so low in prison. So in terms of trying to understand the degree to which partnerships of prisoners are protective, it is true marriage rates are low, but our data show that actually partnerships exhibit some of the same qualities as the rest of our partnerships. They are stable. People have been together for 6 months or longer. A large proportion, 80% or more, saw their partner daily or almost every day, shared finances. So these are important sources of support. So when you just take a partnership away from someone who's in prison and someone who's in the community, you lead them to potentially engage in seeking new partners. And so currently we're looking at this longitudinally. We're recruiting inmates just before they get out. And we are following them for a year to try to understand their HIV risk. And people who are recruited have been in a primary partnership at the time of their incarceration. Some of them will have split from their partner. Others will have stayed together. So we're trying to understand what are differences in terms of the social support they receive, the mental health outcomes, and the HIV risk outcomes for those who remain with their partner versus those who have not, controlling for as many of those background factors that I mentioned. So this is an ongoing study, but it's sort of trying to get at a piece of trying to understand the causal pathway linking incarceration with and other forms of criminal justice involvement and HIV risk. Thank you.